Can vitamin D deficiency contribute to shortness of breath in chronic lung disease? Let's explore the question of whether vitamin D deficiency can contribute to shortness of breath in people with chronic lung disease. Vitamin D is well known for its role in maintaining bone health and supporting the immune system. It helps regulate calcium levels, which is important for preventing conditions like osteoporosis. However, vitamin D's influence extends beyond just bones and may affect various bodily functions. When it comes to respiratory health, the relationship with vitamin D is not straightforward. Some research suggests that vitamin D may have anti-inflammatory effects, which could potentially benefit those with respiratory issues. However, there is currently no strong evidence that directly links vitamin D deficiency to shortness of breath in chronic lung diseases. Shortness of breath, known medically as dyspnea, is a common symptom in chronic lung conditions such as chronic obstructive pulmonary disease and pulmonary fibrosis. This symptom usually arises from issues with lung function, where the lungs struggle to effectively exchange oxygen and carbon dioxide. Various factors contribute to this, including airway obstruction, inflammation, and structural changes in the lungs. While vitamin D deficiency may not directly cause shortness of breath, it could worsen conditions that lead to respiratory symptoms. For example, low vitamin D levels have been associated with a higher risk of infections and autoimmune diseases. These conditions could, in turn, exacerbate existing respiratory problems. From the perspective of osteoporosis, vitamin D is vital for maintaining bone density and preventing fractures. However, its role in lung health is more complex. Individuals with osteoporosis may also experience conditions that affect lung function, like kyphosis, which can make breathing more difficult. In these situations, having adequate vitamin D levels could be beneficial for overall health, but it would not specifically target shortness of breath. In conclusion, while vitamin D is essential for overall health, there is no direct evidence linking its deficiency to shortness of breath in chronic lung disease. The primary cause of shortness of breath in these conditions is related to impaired lung function rather than vitamin D levels. It is important to maintain adequate vitamin D levels for bone health and general well-being, but it should not be viewed as a treatment for respiratory symptoms. If you are experiencing shortness of breath, it is crucial to consult a healthcare provider for an accurate diagnosis and appropriate treatment options.